Hey you guys, this is Dr. Simmons again, checking in. Just want to kind of give you guys an update on some of the things that were going on. I know you guys remember with Foola Health Solutions, also with All Children's Pediatrics, working with a partnership with the Beaufort-Jasper EOC Head Start as well as the Low Country Head Start in Cottageville. Basically what we're going to do is continue to give a series of talks on concerns from some of the parents and some of the viewers out there, try to get you guys educated and up to date on what's going on. We are taking questions at askdoc@bjeocheadstart.com and soon to come askdoc@lowcountryheadstart.com. Otherwise, you can submit your questions to me online, and I'll try to answer them as good as possible. Alrighty, so let's talk a little bit. I want to tell you guys about our, before I get started, about some of our things we're offering, the Head Starts. We're offering telemedicine to the Head Start children, both in Beaufort-Jasper and in Low Country Head Start, which basically means if your child is a patient or a student at Head Start, they automatically qualify for our telemedicine solutions. This basically means that if you're home and your kids are sick and you can't get out, or if you don't want to come out, you can actually contact us through your Head Start, and we will actually provide telemedicine services to your child, and we're actually looking at providing to some of the other kids in your household as well. So give Head Start a call if you need to get some health care services to your children. All right. So before we get started, I want to kind of take a step back and talk a little bit about some definitions. First, I'm going to talk about coronavirus versus the novel coronavirus versus COVID-19. You keep hearing these things thrown around. Basically, the coronavirus itself is actually a class of viruses. So when someone says coronavirus, you're talking about a whole class of viruses. The novel coronaviruses, or what we scientifically call the SARS-CoV-2, is the virus that causes the disease COVID-19. COVID-19 is the name of the disease caused by the novel coronavirus. Another example of that would be that HIV is the virus that causes AIDS. So it kind of helps you to kind of put things into perspective. So remember, when we're talking about the novel coronavirus, the virus is thought to be spread mainly from person to person. It's between close contacts. We generally describe close contacts as individuals who are within 6 feet radius, or 6 feet of another individual. The disease or the virus is spread through respiratory droplets produced when an infected person coughs, sneezes, and now we even think talking can spread the virus. These droplets can land in mouths or noses of people who are nearby, and can also be inhaled into the lungs. You need to understand that COVID-19 can be spread by people who are not symptomatic. I think, as I said previously, it is possible to be symptomatic for days before you actually have, it's possible to spread the virus for days before you have any symptoms. So that's why it's so important to be aware, and this is why we are so concerned about social distancing. Another way that the virus is spread, as we talked about before, is on contaminated surfaces and objects. It's possible that these things, once again, can get on your hand. You can touch your nose, rub your nose, touch your eyes, or touch your face, and spread the infection that way. As far as the surfaces are concerned, it tends to live, if someone coughs or sneezes, or it can stay in aerosolized form for about 3 hours. If it's on copper, it can be there for about 4 hours. If it's on cardboard, we found that it can be there for about 24 hours now. And if it's on plastic or stainless steel, it can be there for 2 or 3 days. So that's very significant. Once again, that's why we really stress the point of washing your hand and wiping things down as much as possible. So now I'm going to talk a little bit about COVID-19, just really briefly, because I know you guys have heard a lot of the symptoms out there. Basically, remember that the symptoms of COVID-19 can appear within 2 to 14 days after exposure. They tend to present with fever, cough, shortness of breath, and or diarrhea. Diarrhea is something that they're not talking about a lot, but it's actually it's out there. So if someone is having diarrhea and shortness of breath, they should seek medical attention, because that means they could have COVID-19 as well. So just want to give you guys some updated numbers. Right now you're hearing all over the news that this is going to be the hardest or the saddest week yet, as far as deaths and hospitalizations. This is because about 2 weeks ago, the infections really started taking off. And so now the infections that have started a few weeks ago are starting to come to their worst part. So this is when you see the people that are going to get their sickest at this point. So that's why they're saying that we are at our peak this week, because we expect the population to be at its highest this week as far as sick individuals. As far as cases in Beaufort right now, let me see. Give me 1 second. Let me get up there on that. Sorry about that. I had my cases, and for whatever reason, I cannot find it. So Beaufort, I believe, has I can't remember. I know South Carolina has over 1,000 cases. Beaufort has about 4 deaths, I believe, and I believe they have definitely over 100 cases. But I know we have about 4 deaths, unfortunately. All right. So getting back on point. So the big thing that we're concerned about really is looking at how fast the United States is increasing compared to other countries. Basically, I have a little graph here. I don't know if you guys can see it. If you look at it, this line that's going up right here, this is the United States. All the other countries, they're leveling off this way. So this is what's happening because of our lack of social distancing. We really have to work really hard. Let me show you guys something else. There's another chart that I pulled up. I like data, and I wish I knew how to do it a little better than this. This is what happens to disease when we don't do social distancing. It goes straight up. It kind of matches the initial curve that I showed you with the current disease rate in the United States. When we do social distancing, initially, if we do it later, there's a curve, which really correlates with more hospitalizations and more death. And then this is what happens when we do more social distancing when we're asked. And this shows a smaller curve. This means that we curb the number of hospitalizations, the amount of illness, and definitely the number of deaths associated with it. I have one more to show you. This is the famed curve you keep hearing about on TV. This is what happens with social distancing. This shows the amount of disease and illness. This shows what happens when we do social distancing. We want the curve to flatten out this way. If not, we keep getting sicker and sicker and sicker. And maybe today's peak is not truly the peak. We will only know this if we really start working hard to kind of get these things under control. So what is the problem? Social distancing. Basically, everybody knows that social distancing is staying at least 6 feet away from other individuals. We're asking individuals not to gather in groups or in crowded spaces and to avoid mass gatherings. But I think what a lot of people are doing is they're really getting a misunderstanding about what we're saying when we say do not gather in groups. So let me kind of be very specific for you. This means avoid large and small gatherings in private places and public spaces, such as friends' houses, parks, restaurants, shops, and other places. Basically, this means no small parties, no backyard barbecues with friends, no sleepers, just stay home. Now, if I was a guy like my main man, Samuel Jackson, a fellow Morehouse man, I would say it the real way, but I'm just going to say it the real nice pediatrician way. Please, just stay home. This stuff is serious. As far as the other thing that we're concerned about, as far as COVID-19, and I think some people are really starting to see, we're really starting to see things that revolve around stress and anxiety. Basically, we know that this can be very stressful for people, especially in the way of the fear and anxiety that can be overwhelming that comes along with this disease and all the things that are going on. Basically, coping with stress will make you, the people you care about, and our community stronger if we do it the right way. As far as parents are concerned, when parents and caregivers remain calm, we can provide our children with that sense of calm they need to make it through this crisis. Basically, not all children and teens respond to stress in the same way. You need to think about a few things. I want to tell you about a few things that actually will that you will see in in your children that you can pay attention to that show that they're actually getting stressed out. Keep in mind, children do not respond to stress the same way we do. We might call up someone and have a conversation. They're not able to always express themselves, so their stress comes out in different ways. Some things you might see would include excessive crying or irritation in young children, returning to behaviors that they've outgrown. So you might see some kids start wetting the bed again, whereas they had outgrown that or had been previously potty trained. You might see unexplained headaches and or body aches. Some kids may start using alcohol, tobacco, or other drugs. Watch out for the vaping. You might see poor school performance or avoiding schoolwork altogether, in addition to difficulty paying attention or having good concentration. You may also see that the children are starting to avoid activities that they once enjoyed in the past, as well as excessive worrying, unhealthy eating or sleeping habits, and just basically having acting out behaviors that you may see in some of the older teenagers. Some things you can do as far as helping the kids out is take time out with your child or your teen and talk to them about what's going on with COVID-19 and the outbreak. Basically answer their questions, share facts, and kind of reassure them if you can. Basically, also you can also reassure your child that they're safe. You know what I mean? That's one of the best things we can do is give our children a sense of security. Basically, share them that, hey, that you're going through some stuff, but this is what you're doing to cope with your stress, and that allows them to have ways to cope with their own stress. This is actually something that's not good, that's just not good for right now, but it's something that's great going forward in the future as far as life and coping skills in life. Basically, another good thing is limit your family's exposure to news coverage. You know, we watch this stuff a lot. We're looking at the curve, and we're looking at how things are going up. But basically, sometimes they cannot process things like we can, and it can cause additional stress with children. I would definitely suggest you guys try to keep a regular routine with your children. They're not in school, but they need to keep that regular school routine, because basically it helps them get their schoolwork done better and actually helps their days and your days go better all over. And last but not least, be a role model. Take breaks, get plenty of sleep, exercise, and eat well. Connect with your friends and your family, because that's where we find our greatest strength. All right, now the other thing you're seeing on the TV and all over the news is you're seeing the responders, the healthcare professionals, the people who are actually taking care of individuals, and they're stressed. I can tell you, as being a physician and being on the semi-front lines, may possibly get exposed. It's stressful because sometimes you feel like, hey, it's only a matter of time before somebody walks in and exposes me to COVID-19, which basically means that I may have to stop working or I may have to start taking other precautions, and that's a concern. Basically, as far as responders are concerned, there's some things that we can do to reduce our stress, and what they call our stress now is secondary traumatic stress reactions. And so, as far as we're concerned, if you're a health provider, acknowledge that your stress reaction is an impact of helping families or anybody during time of a traumatic event. You know, we get burned out from helping people as well. Learn the symptoms of your burnout. Basically, if it's a physical symptom, if you're feeling tired, if you're starting to get sick, let someone know. As far as mental issues, if you're starting to have fear, withdrawal, or feeling guilt, that's also very important to kind of pay attention to. You need to also make sure you allow time for you and your family to recover from responding to the pandemic. So when you get home, take some time to let your hair down. If you got hair, I don't. But if you take a chance, unwind, talk to your family. It's also good to create a menu of some personal care activities that you like. Things that are your hobbies, things that will help you keep your sanity. It's always good to have those things. And of course, take a break from the media. We talked about parents taking a break. As far as healthcare providers, we know a lot of stuff. And sometimes the things that we know will cause us to be more stressed because we think we know where the course of where things are going to be. So take a break from the media and help yourself unwind. And the biggest thing of all is, if you're feeling overwhelmed, ask for help. You know what I mean? Because basically there's no reason for you to go through this and realize that or think that you're by yourself. Because there are a lot of people that are going through this as well. Everyone needs to understand that there are resources out there for the mental health issues that we may have, as far as depression, anxiety, and just the general stress from going through the pandemic. If you call your local Department of Mental Health or visit their website, they definitely have information. They have resources for parents and healthcare providers, including a hotline to address issues concerning anxiety and depression. So I definitely recommend you guys check that out. Now I'm going to talk a little briefly about face masks. The reason that they're asking individuals to wear face masks is because they're thinking now that, number one, that it's possible that the virus COVID-19 could be spread through talking, so it could be much smaller droplets. And so the purpose of wearing masks are not to prevent you from getting infected. However, they are to prevent you from spreading infection to someone else. So they're recommending that you wear face masks in all public settings where social distancing is not entirely possible. These include things like grocery stores and pharmacies, or areas where there's a significant community transmission. They suggest getting a cloth face mask. However, there are a few things you should know about this. Cloth face coverings should not be used in children under the age of 2, anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the mask by themselves. They also recommended that you use cloth face masks, and if you check the CDC website, they actually give great information on how to make these things. But they recommend that you use these and not the surgical masks or the N95 respirators. These are used by the health professionals, and there's already a shortage, so if everyone starts buying these, there won't be enough for us. And this is highly important for us because we're the ones who are getting exposed. So if people are buying all the masks, our exposure goes up. You have to understand, if all the doctors are taken out, there's no one left to take care of the patients. So please try not to use all the N95 respirators or buy all the surgical masks, because those are the things that we need because we're on the front line. All right, so here's some things you should know, because there are a lot of people out there who are making cloth face masks. How do you know when it's something that's good? Basically, it has to fit snugly but comfortably on against the side of your face. Has to be secure with and tied with ear loops. It has to include multiple layers of fabric, and it has to allow for breathing without restriction. Can you hear this? So this is mine. It's made for me by a friend, and it has to be able to be laundered. And machine dried without damage or change in the shape, because that's actually what helps to slow the spread of the COVID-19 virus. The biggest question that people are going to ask: can I clean it? How regularly do I clean the mask? You should clean it for sure, and how often you clean it actually depends on how often you're using it, how often you are in those situations. I would say once every day or so, keeping in mind that the virus does not stay on the virus only lives on certain things for a certain period of time. But if you're afraid, wipe it down, spray it down with some Lysol, wipe it down, and wash it. Better safe than sorry. All right, so I got one more picture to show you guys. Can you see this? If you can see it, it's a tiger chasing a chicken. And this is for all my conspiracy theorists. So, what do you think that chicken is thinking as he's running across the road? Do you think he's thinking about who let that tiger out the pen? I don't think so. What he's thinking is, I got to get the hell out of this tiger's way. So why am I saying it that way? At this point, we don't care about what you're saying about the conspiracy theories and theories, because it doesn't matter. Right now, people are dying. This stuff is real. So at this point, we can always go back next year, and once this is done, and take a look at whatever reason you think is causing it. But right now, let's practice social distancing. Let's do the right thing so that we can get this thing taken care of. We can take care of ourselves. Now, what people always ask me is, Doc, are you scared? Yes, it's scary. It scares physicians. It scares healthcare providers, because this thing is very contagious and it has the potential to kill a lot of people. We can beat this, but not if we don't work together. Do not wait until it's your family member, the one who's the one that's on a ventilator, or who's the one that's sick, or who's the one, God forbid, that dies, before you realize that this is real and that this is not a lesson. I'll always close with saying, as always, wear your mask, don't touch your face, wash your hands, be safe. Take care. Love you.